A recent online survey of more than 120 plastic surgeons nationwide has resulted in the bad and frankly surprising news that only half of them know how to properly wash their hands. You heard that right. A research team at Thomas Jefferson University Hospital conducted the survey to establish the current hygiene knowledge and standards among a group of ear, nose, and throat trained facial plastic surgeons. And overall, the survey showed what the final study termed suboptimal hygiene standards. Only 53% of the surgeons were aware that alcohol-based cleaners were best against bacteria on hands that appeared clean. 74% of them were aware that soap and water is best on hands that appear dirty. But only 42% of the surveyed surgeons knew the correct answer as to how often they should clean their hands during an operation, which is before and after having contact with a patient and before and after wearing examination gloves. Proper hand hygiene is crucial since it is the best way to prevent the spread of germs and infection in any hospital setting and certainly during facial surgery. The low survey results do indicate that correct standards aren't being met, and the reason may include misinformation, a lack of time among surgeons, a shortage of sinks, and possibly aversion to chemicals that irritate skin. The research suggests that hospitals provide written guidelines and easily accessible cleansing products and monitor hand washing practices. Interestingly, this is already the standard at all accredited surgery centers and hospitals. What is not clear from this study is whether the lack of knowledge in hand washing trivia actually translate into any problems with the surgical procedure. The infection-related complications in facial procedures is exceedingly low. This study also surveyed facial plastic surgeons who go through a different training pathway than board-certified plastic surgeons via the American Board of Plastic Surgery. We spoke to Dr. Jeffrey Keys about data on hand washing from board-certified plastic surgeons.
The study itself says a number of things, and I'm not sure that a prospective patient has to be overly concerned about it, because what happens usually when a surgeon's going into surgery, whether it's in an outpatient setting or a hospital setting, they usually are provided with this type of a sponge with already sterilizing material built into the sponge. This particular one is chlorhexidine gluconate, and it'll certainly make you totally prepared for surgery and can be used in lieu of betadine or alcohol. As a matter of fact, very few of the current sponges that are used are pure betadine, and some of them may be alcohol-based, but I don't think many surgeons even use betadine to scrub their hands before surgery. You know, the first thing that surgeons learn is how to scrub their hands before surgery. Not just surgeons, but nurses and anybody who's going to be in the operating room. So whether or not a surgeon's board certified doesn't really establish whether he's learned how to wash his hands well. That's just part of training for any surgeon. The idea of a surgeon's hands being dirty might be construed to mean that the surgeon has had a previous operation that he's performed prior to the scrubbing for a next operation. And of course, in those circumstances, it would be necessary to really give a good scrub. And that's true after patient contacts too. So that portion of the article makes great sense. It's just that in today's environment, these prepackaged scrub sponges are really what most people are using.